Amyloid is composed of peptide fibrils arranged in a beta-pleated sheet pattern. This causes some starch-like characteristics, and the term amyloid is derived from the Greek amylon, which means starch-like. The deposits are irreversible, and amyloid may be systemic or localized. This is a longitudinal section of tongue that has been stained with Lugol's iodine, and the amyloid has stained black in the same way that a deposit of starch would stain black. So this picture illustrates the starch-like quality when it comes to staining with iodine that amyloid has. There are two main types of amyloid, AL amyloid and AA amyloid. AL amyloid used to be termed primary amyloid because the cause of it was unknown, and AA amyloid used to be called secondary amyloid, where a predisposing cause was identified. AL amyloid is derived from light chains, usually caused by myeloma, and it is the commonest type of amyloid in North America. AA amyloid is derived from serum amyloid A. This is an acute phase protein, and this occurs secondary to chronic inflammation, and it is the commonest type of amyloid worldwide. So firstly, AL amyloid. This is caused by myeloma, and myeloma is a tumour of plasma cells. Malignant plasma cells produce light chains, or usually produce light chains, and the amyloid is derived from the light chains. Inflammatory conditions associated with AA amyloid include rheumatoid arthritis, Crohn's disease, ulcerative colitis, bronchiectasis, TB, and osteomyelitis. There are, however, some neoplasms that may produce AA amyloid. These include Hodgkin lymphoma and renal cell carcinoma. Another cause of AA amyloid is a hereditary disorder called familial Mediterranean fever, or FMF. The adverse effects of amyloid are caused by the buildup of the deposits in blood vessel walls and basement membranes, resulting in cellular dysfunction and compression and damage to the cells, and also prevention of diffusion of extracellular fluids. One structure fairly frequently affected by amyloid is the glomerulus in the kidney, and you can see amyloid deposits in this glomerulus, and these are the rather pale amorphous pink areas in the glomerulus. Localized amyloid occurs in a number of specific conditions, including medullary carcinoma of the thyroid, where the calcitonin is incorporated into amyloid that is deposited amongst the tumour cells. In some patients with type 2 diabetes, amylin is produced, resulting in islet cell amyloid deposition, and in Alzheimer's disease, a beta protein is deposited in the brain. This is a section of medullary carcinoma of the thyroid, and you can see a pinkish band, and this is a deposit of amyloid. And this is the same tumour that has been stained with Congo Red, staining the amyloid a pinkish red. Clinically, systemic amyloid may present in a number of ways. If amyloid is deposited in the kidneys, then this will typically cause proteinuria and nephrotic syndrome. If amyloid is present in the heart, this can cause cardiac failure and arrhythmias. Amyloid may also present as carpal tunnel syndrome, hepatosplenomegaly, and macroglossia, and purpurae. Here are two slices from an enlarged spleen. The slice on the left is without a stain, but the slice on the right has been stained by Congo Red, and this demonstrates a very substantial deposit of amyloid. This is a section through the ventricles of the heart that has been stained with Lugol's iodine, and you can see that there is a large amount of black, indicating extensive amyloid deposits in this heart that will have caused heart failure and death of the patient. Because amyloid is deposited in the rectum, in approximately 60 to 70% of cases of amyloidosis, taking a rectal biopsy and staining specifically for amyloid with techniques such as Congo or Sirius Red is a very useful diagnostic tool for confirming a diagnosis of amyloidosis. The amyloid deposits in these glomeruli have been stained pink with the Congo Red. When the stain is polarized, the color changes to apple green. There are other rare causes of amyloidosis. These include hereditary amyloidosis that may be subdivided into ATTR amyloidosis and non-TTR amyloidosis. There is also a wild type of ATTR amyloidosis, otherwise known as senile systemic amyloidosis. Finally, another group of patients at risk of amyloidosis are those receiving dialysis for renal failure. And it is the beta-2 microglobulin that is the component of amyloid in these cases.